A study published in the British Medical Journal threw panic across the medical world. The study looked for complications up to 28 days after being jabbed or infected. It found that for every 10 million people vaccinated with the AstraZeneca jab, an extra 107 would be hospitalized or die from complications due to internal bleeding. It further revealed that an extra 66 would be hospitalized or would die from blood clots in the veins. Research also examined the Pfizer vaccine. The reaction has been intense. Dr. Henry Dungu, a hematology consultant at the Uganda Cancer Institute in Kampala, acknowledges the risk but maintains that it's containable.
You receive the vaccine 4 days to about 42 days. So if you are within that time frame, you receive the vaccine and then you have features that could suggest that you might have a blood clot. For example, you have a swollen leg, you have severe headache, you have chest pain, you have abdominal pain. Features that could suggest you could be having a blood clot. You might be having that.
Dungu says the minimal risks should not be presented as an excuse to disregard vaccination.
Many people with COVID-19, they will actually die of blood clots. Many of them. Not because they got a vaccine, but because they have COVID-19. That's why, from a public health approach, you cannot say because 1 in a million will get a blood clot, let's not roll out the vaccination program. It does not make a lot of meaning if you do it like that.
He admits that different types of COVID-19 vaccines have been associated with formation of abnormal clots, but the risk is so small.
The truth is, these vaccines, maybe the different types, J&J, AstraZeneca, have been associated with formation of abnormal blood clots, not the usual ones. And actually when these clots come, that treatment is even different. The truth is it's there, but the risk is so small that it does not stop us from taking a vaccine.
The doctor advises the public to always report abnormal symptoms after vaccination. The concerns and subsequent public reluctance follow previous indicators such as altering menstruation cycle in women and erectile dysfunction in men, among others.
What has been almost true is for someone who has had COVID-19, there are many reported cases of some degree of erectile dysfunction following COVID-19. And this is attributed to the psychological challenges someone goes through. And also to some extent, if say someone got a blood clot as a complication of COVID, they might get decreased blood flow to their genitals and then their erectile functioning might not be good.
Government continues the mass vaccination exercise targeting specific groups. Currently, teachers in the Kampala metropolitan area are undergoing vaccination before it's rolling out countrywide.